Hello everyone, my name is Aslan Aziz and I'm studying in Ravensbourne University. I have done my bachelor degree from Punjab University of Lahore, Pakistan in GIS, Geographical Information System. Now I'm currently studying in Ravensbourne University. My course is MSc Project Management and the subject is Innovation and Enterprises. Today I would like to talk about my presentation about PCOs. PCOS is I would like to talk about a little bit introduction about the PCOS. PCOS is a disease like it appears in like a woman. It affect in the whole world. In like the ratio is the PCOS ratio is 8 to 13% in overall the women. And today I would like to talk about overbalance or organics evidence govern organic sport kits for polycystics ovary syndromes. Firstly, I would like to talk about the venture positioning. The PCO specific organic sportive care venture, subscription based monthly case integrating herbal sportive lifestyle, education, and evidence governance. Explicitly positioned an adjective sport, not a medical treatment or cure. PCOS organized as a chronic endocrine and metabolic condition requiring long-term management rather than episodic intervention. The next is understanding PCOS scale and complexity. PCOS affects approximately 8 to 13% of women of reproductive age globally, within prevalence varying by diagnostic criteria. And it is characterized by hyperdronisms, ovulatory dysfunctions, polycystics, ovarian morphology. The PCOS is associated with long-term metabolic, reproductive, and psychological risk, including insulin resistance, infertility and anxiety and depression. These all diseases are appears in like PCOS. Diagnostic heterogeneity genetic leads to under diagnosis and inconsistent care pathways, increasing patient reliance on self-management strategies. The next one is limitations of current PCOS management pathways. You know that is already mentioned in the diagram. Care pathways patient journey map template, and in this chart and in this picture, it's already showed the pharmacological treatment. Contraceptives are clinically effective for symptoms control, but often associated with weight changes, long-term adhere changes, and international guidelines recommending lifestyle modification as first-line management, yet structured long-term support is limited. Many women independently use supplements and herbal products without clinical guidance, increasing safety and misinformation risk. The care gap is structural, not to the patient lack sustained credible pharmacological supports. The next one is the market opportunity, women's health and supplements. The global wellness economy exceeded US $44 trillion in 2022, driven by preventative and lifestyle oriented health consumption. The Global Wellness Institute, it is calculated by the company, and the Global Institute is the Global Wellness Institute by 2022. The global herbal supplements market is projected to exceed USD $80 billion by 2030. We will see in the future it will be exceeded like $80 billion, reflecting growing demand for plant-based health products, and PCOS specific supplements and sport products remain underdeveloped relative to disease prevalence. Market growth indicates opportunity, but also intensifies scrutiny around evidence, safety, and claims governance. The next one is identify gap in the market. We know that about the gap in the market in 2022 is $4.4 trillion, but we will see in the future it will definitely increase like $8 billion, $8 billion USD dollars. Existing herbal supplements, generic rather than PCO specific, poorly contextualized within clinical guidance. Social media driven PCOS advice ecosystem frequently promote unsupported claims, undermining trust issues. The patient requirement requires structure, transparent, and conditions aligned to support rather than isolated products. Opportunity. We have opportunity at PCOS specific evidence governed organic support ecosystem addressing this gap. Now I would like to talk about the our Balance Organics solution design. We have some solutions about the monthly PCOs supporting kits integrating evidence screened herbal supplements, organic teas, and tea structure. We have tier subscription like standard kit, personalized kit, and we have also PCO's requirement continuously behavior reinforcement. And the next one is integrated strategies, scientific evidence and limitations. We have some scientific evidence and limitations in PCOs and also in the supplements, in the PCO supplements. The first one is spearmint. The second one is turmeric. The third one is our like ingredients. We have a lot of ingredients, but the main is spearmint, turmeric, and ashwagandha. Strategic risk and mitigation. In this slide, we see that investment risk and investment risk about the regulatory risk, safety risk, reputational risk, and also in women's health, the risk governments determine the commercial survival, not demand alone. The next slide is about the social and also strategic values. And this one is also including funding requirements like 3 years horizon. In this slide, here is some kind of conclusion about the PCOs and also for the medicine about the PCOs. And this one is all conclusion about the PCOs and also for the medicines. Here are some kind of references about my presentation, about my data, and also about my whole PPT. And here is my whole presentation. Thank you so much.